As Massachusetts Governor Charlie Baker has announced the details on reopening, an important component of the plan will be contact tracing. As a result, Baker has set up a community tracing collaborative. But before the state went in that direction, the city of Northampton formed its own collaborative with surrounding towns to assist in reaching out to the contacts of people who have tested positive for COVID-19. Carolee McGrath sat down with Meredith O'Leary, the public health director of Northampton, to learn more.
Early on, I'd want to say about the last week of February or so, I recognized that there was going to be a demand in our smaller rural communities that don't have infrastructure or public health nurses or health departments to assist with contact tracing. Contact tracing is nothing new to public health. We do it all the time with other diseases such as measles, pertussis, even with foodborne illnesses, so on and so forth. So it's been part of our responsibilities from the beginning, but obviously never to this extent. So with that being said, Northampton is one of the largest communities within Hampshire County. A lot of our communities are smaller, rural, like I said, and don't have health departments or infrastructure. They just have a volunteer board of health. So knowing that, I quickly started to think about, as this epidemic grew or this pandemic grew, what does that look like in terms of investigations, monitoring, doing surveillance and monitoring for these communities, and doing any contact tracing? How would them not having infrastructure actually impact us when we do our contact tracing? Because, you know, people don't stay within their own communities. They might live in one community but work in another, and vice versa. So I put together a public health nursing collaborative, and I asked everyone in Hampshire County if they wanted to participate in this. It was a very natural fit for the city of Northampton to do this because we are the fiduciary host agency for the Public Health Emergency Preparedness Coalition. So people are familiar with me, familiar with our work, and familiar with this regional effort that we already have. So again, it was very natural for me to put this out saying, can, you know, do a needs assessment? Is this something that you need? And if so, how can we help? So again, 11 communities definitely reached out and said, we absolutely need the help. So with DPH releasing funding, 2 rounds of funding about 8 weeks ago, we just asked for a small portion of their funding that the community was receiving to help support the contact tracing efforts and the monitoring and surveillance for disease.
So what happens? How are you informed in the first place that somebody in your community or one of the surrounding communities has tested positive for COVID-19?
Sure. So Massachusetts has a surveillance system that's called MAVEN. And what happens as soon as that there's a laboratory confirmed case of COVID-19, the surveillance system will actually connect with the local health department for which the person resides in and lets them know that somebody is positive, either presumed or positive. So, and then whoever works in that community, in that public health department, will be assigned that case and open it up and start the investigation. So just because somebody works in Northampton but may live in Southampton, the communication from the surveillance system will actually go to the Southampton Health Department. And then it's the Southampton Health Department then has to get in touch with the Northampton Health Department to continue with the investigation, as it may, this person's may have an impact in one of our businesses for where they worked.
And so what do you do? So you call that family, that person, and you say, you know,
right, we'll call that person the index case. So the person that is identified to be positive, we'll call them the index case. My public health nurse or one of my nurses in the collaborative will actually call them up, let them know that of their status if they haven't found out already through their primary care physician, and then we will tell them what needs to be done. If you're positive, you're actually put in isolation for X amount of days, and we'll explain to them what isolation is. We also at that time ask them about their whereabouts and who their direct contacts may be, and there's a definition of what a direct contact is. It's proximity and time. And if you fall within this definition, you are considered a direct close contact. So we want to identify all of our direct close contacts to this index person, and then we will then contact them to tell them what they need to be done. So if they're direct close contact, they need to go into quarantine. We explain to them what quarantine is. And right now we also advocate that they get testing. Testing has opened up in the state of Massachusetts to all direct close contact.
Okay, so if they're tested and they're negative, they're in the clear. They don't have to quarantine. But what about?
No, that's not true.
Oh,
that's
okay.
not true. So if they test negative, they're still in quarantine for 14 days. The incubation period for COVID-19 is anywhere from 2 to 14 days. So that's why we use 14 days as our threshold point. So once you're in quarantine, you're there for 14 days, whether you test negative or not. We ask you to test right away because we are very curious about asymptomatic transmission. You can be positive, but not show any signs. So if you test you're negative, you're still in quarantine and you need to monitor for symptoms. And if you do become symptomatic through the course of that 14 days, you go and get another test.
Tell me a little bit about protecting a person's privacy, though, right? So you find out that somebody in the town has COVID-19, you call them and realize that they were at a park or at their place of work, and now you have to go and contact the people that they have been in touch with. But at some point, people might start to, put it together and figure out who it was who had COVID-19. And I feel like there has been a little bit of stigma, I'm sure you've noticed this, around this. And I think some people really want to stay private and not feel like, well, I'm the one who just, got everybody sick at work.
That is very, very important to us, maintaining HIPAA compliance and privacy. That's why very early on, I myself took a stance as the public health department not to relinquish any type of data or statistics to any type of news or reporter that asked. And, we did get a lot of pushback saying that the community has a right to know. And I would not release any type of statistical data on how many people were sick, how many people died, so on and so forth, because in such small numbers, it's very easy to get identifiable information out of that. So it is of utmost importance that we do maintain privacy and HIPAA. However, with communicable disease, if you are considered a direct close contact, whether it be COVID-19 or measles, there has to be some sharing of information. Otherwise, you would not be able to contain an outbreak or the spread of disease. So the people who need to know are absolutely in the know.
So how do you think this is going to ramp up now as the state moves to reopen?
We've seen this wave when it comes in regard to contact tracing. Before the state closed down, thankfully, we didn't have a lot of cases here in Northampton or in, Western Massachusetts as a whole. So contact tracing was a little different, because people were still doing their daily routines, going to the gym and going to work and socializing. And then we have this stay-at-home advisory. So you're really kind of besides going out, hopefully for the things that you absolutely need, your supplies and your medication, you're at home and you're kind of quarantining with your own social pod, right? Whether it be your family or whatever that looks like. So doing contact investigation right now is pretty easy for us. It's usually just your household members that we have to talk to, and sometimes employers. Now that things are going to open up, it's going to look very different, because we have a lot of cases here in Western Massachusetts, and they're growing by the day. And to do contact investigation, as people's worlds open up, you might see more people, going to some of the establishments that are now open or going to be open on the 25th, maybe doing a little more socializing. So it's going to be a little more labor intensive to try to figure out where you were and who you saw and who was a direct close contact within this 48-hour period prior to you becoming symptomatic.